knock.
Come in.
Hi, my name is Monique Smith. I'm a Cincinnati State nursing student, and today I will be doing an assessment on you, if you don't mind. All
Okay.
right. But first, before we get started, what is your full name and date of birth?
Alexis Daniel Barber, 10/20/1998.
All right. So, Miss Barber, as I stated, I'll be doing an assessment in which I will be taking my stethoscope and I'll be listening to different parts of your body, and then I'll also be using my hands and to feel and touch different areas of your body for symmetry. All right.
Okay.
All right, before we get started, let me clean my stethoscope, which I cleaned already. And then I'll put on some gloves, some clean gloves. And how are you feeling today?
I'm feeling well. How are you doing?
I'm okay. Do you know what city you're in?
Cincinnati, Ohio.
Okay. All right, once again, could I get your full name and date of birth?
10/20/1998. Alexis Daniel Barber.
All right, that's you. Do you know what season it is?
Spring.
It's spring. It's nice outside too. Do you know what year it is?
2021.
All right. Let me grab get some vitals from you, in which I will get your blood pressure, your temperature, your pulse, your respiratory rate, and your O2 saturation rate. Okay.
Okay.
All right. So, the first thing that we're going to do, I'm going to give you three words. You're going to repeat those words to me, but then I'm asking you to remember those three words so we can recall them at a later time, okay?
Okay.
All right, the three words that I will give to you is blue, floor, and bird. Can you remember those?
Blue, floor, and bird.
All right, so I'm going to start off by using my pen light, and we're going to do to check your eyes. Do you wear any glasses,
Yes.
contacts?
Yes, I wear glasses.
Okay. Have you had any vision problems? Any issues with your eyes other than you wearing glasses?
No, ma'am.
Okay. So I'm going to shine this light. This is my pen light. I'll be shining it in your eyes, checking for constriction and restriction of your eyes. This is called perla. It's called pupils equal around reactive to light and accommodation. All right, so here we go. I want you to look at my ear, and I'm going to come in on your left side and shine my light. All right. Ear to the right. All right. Now I want you to look at my pen and follow my pen with your eyeballs, okay?
Oh.
All right. So that's called accommodation, and look like your pupil size was a size 4. Um, so the next thing that we're going to do is I'm going to check for symmetry in your face. Can you raise your eyebrows for me? Can you smile for me? Can you frown? All right, so it looks like your face symmetry is symmetrical bilaterally. Any problems with your swallowing or taste?
No,
Are you
ma'am.
having issues, difficulties, soreness, or pain?
No, ma'am.
All right, so I'm placing my hands right here by your throat, and I want you to swallow for me. Okay, swallow one more time. All right, so that was really good. It was a nice flow. Could you shrug your shoulders for me? One more time. All right, so shoulders are equal, rise and fall bilaterally. All right, so with that being said, I would like for you to repeat those three words that I gave to you.
Blue, floor, and bird.
All right, so now we're going to do a hearing test, okay? So I'm going to want you to cover one of your ears, and I'll whisper a word in your ear, and I want you to repeat that word, okay?
Okay. Green.
And I want you to close your other ear, and I'm going to do the same thing.
Yellow.
Okay. So hearing is good in both ears bilaterally. Also, now I want you to read this paper for me. hold this up eye length apart and read that for me.
Reach new heights with the United States Air Force.
Thank you. So no, seems like no vision issues. Right. So it looks like Mrs. Barbara's skin is appropriate for ethnicity. I don't see any signs of any skin breakdown. It looks like Miss Barbara is alert and oriented times 4. And also, Miss Barbara, can you use your hands and touch your nose for me? All right. Looks like Miss Barbara is able to follow commands. All right, so now, Miss Barbara, I'm going to check your pulses. I'm going to check your radial pulses on both of your arms. So we just want to check for butt. Thank you. All right, pulses are strong bilaterally, both sides. I would say about a 2. Now I'm going to go up and check your brachial artery pulses. Brachial arteries are strong bilaterally, plus 2. All right, so now I'm going to check your capillary refill. That way I will check your blood flow in your arms. Unfortunately, I don't color polish. So I'll be squeezing your fingertips just to see how fast your color comes back to your fingernails. Oh, I can see them. Oh, that was brisk. All right, they're brisk. All right, now I'm going to oh, now I'm going you to hold my hands. I want you to squeeze my hands. All right. Now I want you to try and pull me back. All right. Muscle tone and muscle strength is good, strong bilaterally. All right. So now I'm going to do your capillary refills on your toes by assessing your skin on your legs as well while I'm doing it in your feet. Um, there seems to be no sign of edema. Skin is kind of cool. Warm, dry to the touch. I'm going to also do capillary refills on your toes. All right, capillary refill is brisk times 2 bilaterally. Now I'm going to be checking your posterior tibial pulses. That's behind your ankles here. Okay, those are equal bilaterally pounding. And we're going to check your dorsal pedis pulses. Can you flex your toe up for me? All right, because that artery is, that vein is here by your, all right, you can relax. All right, and they're good bilaterally. Now, I want you to push up on my hands with your feet. All right, now push down. All right, so that is strong bilaterally. All right, then I also will check her femoral pulse, which is in between her thigh and her foot. All right, so the next thing that I'm going to do is I'm going to just assess your chest rise. But with that, I'm going to place my hands on your back, and I want you to take a deep breath for me, okay?
All right.
And let it out. All right, so chest rise is symmetrically bilateral, strong. All right, so Miss Barbara, I'm going to listen to your lungs. Okay, so each time that I place my stethoscope around you, I will want you to take a deep breath. I'm going to start up at your top of your collarbones. All right. All right. And I will work my way down until I end up by her rib cage. One more breath for me. All right. And my next time, I will listen to your lungs laterally. But I want you to raise up your hand for me. All right. And I would listen. Take a deep breath for me. All right. And I will listen on your left side. So I'll be going in the triangle area. Triangle. So lung sounds are clear, anterior, bilaterally, and they're clear laterally, bilaterally. No signs of any wheezing or crackling or rhonchi. I'm also going to listen to your lungs on your back. So if you don't mind turning to the side for me. All right. All right. So lung sounds are clear. No signs of crackling, wheezing, or rhonchi bilaterally posterior, as well as no crackling, wheezing, or Rankai anterior or laterally, bilaterally. All right, so Miss Barbara, the next thing I'm going to do is I'm going to listen to your heart. I'll be listening for any more murmurs or any abnormal heart rhythm. You ready? All right, Miss Barbara. So now I'm going to listen to your heart. I'm going to start here at your supersonic notch, work my way down to your angle of Louis, and then over here to your right, your second intercostal space, and this is where I will listen to your aortic valve. S1 and S2 is present, no irregular rhythm or irregular sound. No irregular sound. Then I would go over to your left, to your second intercostal space, and I will listen to your pulmonic valve. S1 and S2 is present, no irregular sounds. And then I will go down from your second intercostal space, third rib, third intercostal space with Erb's point, fourth rib, fourth intercostal space, and I will listen to your tricuspid valve. No irregularities there. S1 and S2 is present. Alright, S1 and S2 is present. Then I will come down to your fifth intercostal space, mid-clavicular line, and I will listen to your matrial valve. S1 and S2 is present. No signs of irregularity. All right. So, Miss Barbara, is everything okay still? Mm-hmm. All right. So at this time, I will be assessing your abdomen. At first, I'm inspecting your abdomen. Abdomen is round. No signs of distension. Other than pregnancy, but no signs of distension. Um, Skin is intact. First, I will listen to 4 quadrants of your abdomen, starting right to left. I'm sorry, left to right. That's how we'll start. This is the your left upper quadrant. I will go over to the right upper quadrant. Bowel sounds are heard. This is your right lower quadrant. normal active vowel sounds. This is your left lower quadrant. All right, so we have normal active vowel sounds in all four quadrants. Now I'm going to take my hands and palpate. I'm checking for any different sizes or any masses. Let me know if there's any pain or discomfort, okay? All right. How does it feel?
I feel okay.
All right. So now, Miss Barber, I want you to stand up. All right. Are you? Do you feel any lightheadedness or any dizziness?
No.
Okay. So what we're gonna do is we're gonna test your gait.
I will.
I want you to step one foot in front of the other and walk for me. Look straight ahead. As you go, turn back, turn around and walk back. All right, now we can turn around and sit down. Gait is steady. No signs of wobbliness. All right. So this will conclude my head to toe assessment. Thank you guys for watching.